Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price but stay for the service.
And welcome back. We are going into our first segment, and as promised before the commercial break, we have been joined by the Chief Executive Officer in the Ministry of Tourism and Civil Aviation, CEO Yashin Dujon. Good morning, CEO.
Morning, everybody.
How are you doing today?
Very well, very well. It's a beautiful day in Belmopan.
All right. So, you know, there are quite a number of questions that we want to put forward to you in our conversation this morning in respect of the state of the tourism industry and, of course, looking forward to the reopening of the airport and what the stakeholders in the industry have been doing in preparation of the reopening. So let's begin there. I know that you've spoken with stakeholders over the past few weeks. I know that there are certain programs in place to try to get them properly ready ahead of the reopening. What has that conversation with stakeholders been like?
Well, actually, it's been quite productive. Just to go back into what it is that we have been doing for perhaps the viewers out there that are not aware yet, the BTB and the Ministry of Tourism have been launching a training program to instill better biosafety protocols and develop safe zones for tourists to travel in that do not risk the spread to the general population here in Belize. So we've been working with the stakeholders and partners who have been interested in being ready for this reopening. And they've been receiving training and still are undergoing training to develop these standards and protocols to protect their staff and employees and themselves from the spread of COVID-19.
Yeah. So let's talk about what some of these protocols are. CEO, I know you're aware of how concerned Belizeans are at this moment. So the more we know and the more we understand, it can help to ease some of the concerns. When a person arrives at the PGIA come August 15th or thereafter, they, according to what has been, the information that's been provided to us and publicly by now, they're highly encouraged to have taken a PCR test 72 hours before arrival and to upload it into the system. Now, looking practically at the situation in the United States and the turnaround time for testing, it's not very likely that a lot of our visitors will have had those results to present. So what happens when they arrive at the airport? And then let's move through that process.
Okay. Well, let me start by saying that the pre-travel PCR test, the one that is done and presented within 72 hours, is only for a process flow at the PGIA. Yeah. When somebody lands and comes off that plane at the Philip Goldson International Airport, they will go through a line. There is a small clinic being built right now, or a testing facility being built at the Philip Goldson International. Yeah. And the passengers will be tested when they get off the plane before they enter the customs and immigration area. That testing is a rapid test, and that will be yielding either positive or negative results. Somebody testing positive for COVID-19 will go into immediate quarantine. Those testing negative will be allowed to go through the immigration and customs process. But that process at this time now is being digitized and upgraded, and it's being evolved into an app that people will have on their mobile devices. And that app will also have a health monitoring component to it. And that component will monitor your health. People from the Ministry of Health will be checking in with those folks on a daily basis. And you'll be able to contact emergency health personnel if you have any symptoms of COVID-19 whilst you're here in Belize.
Yeah.
One of the questions, and I know that at the last press conference where the Prime Minister introduced these new measures that will come into force on August 15th in respect of the reopening, one of the questions was, well, how do we ensure that while, yes, the visitor will have the app on a mobile device, that they would simply not, for instance, turn off their cell phones and go about the country without being followed or traced or contacted by the relevant authorities. That was one concern that immediately came up. The other was, from a broad perspective, it would seem a bit ambitious, all the steps that we're putting in place to ensure that all the protocols insofar as health and safety are being adhered to. Yeah. How would you respond to that?
Okay, Sonny, let me take your first question. With regard to the tracing, what's being done right now is that when you download this app, you have to be in constant contact with individuals from the Ministry of Health that will be doing this monitoring. Yeah. But the other thing that the app will do for you is that when you actually enter the country and fill out the biodata information, etc., it generates a QR code. And that QR code will be used for your processing through the health facility at the airport. It'll be used for processing through customs and processing through immigration as well. It'll also be used when you check into the hotel, that it will be a requirement that this QR code be presented for the booking of the tours within the safe zones, for booking of maybe even a restaurant within these safe zones. You have to have that QR code, and it allows us to do the tracing that we have to do in the back end, should cases be found positive. Yeah. So it's not so simple that you can just download this thing now and leave your phone at home. If you do leave your phone at home, you'll be denied service within these safe zones.
Okay, interesting. Now, okay, so the other question that I was asking though, in terms of big picture and the idea that for some it appears to be ambitious that we would be embarking upon all of these changes within a specific period of time?
Yes, that's a great question, and that's exactly why we're using these safe zones. We realize that the public attention to biosafety protocol is somewhat waning since the lockdown. And we realize that instead of biting off more than what we can chew, what we're going to do is work within these safe zones to ensure that the stakeholders, the employees, the business people within these zones all fully realize how much detail needs to be paid to the biosafety protocols. It also allows you to shut down a specific safe zone if you have to, if they're not being adhered to. This, again, gives us time to continue to expand the training and to roll it out to the entire industry, but also to secure that you're maintaining safety protocols and safe areas should the need come up.
Yeah. You know, I want to be able to say this, at least at this point. There's no perfect plan. And we're facing an unprecedented situation. Once in a century, we see a pandemic, and being able to restart tourism under the most responsible terms is new for everyone. Having said that, we do have the benefit of looking at what other Caribbean nations are doing, and they're learning some tough lessons as they go along. Bahamas recently decided to close their airports to U.S. travelers because of the number of cases they were receiving, and also because most of their tourists come from the United States. So 3 weeks after reopening, they decided the U.S. doesn't have their situation on the handle. They won't take American tourists. Jamaica has looked at developing a threshold, a certain number that says if we hit this number of positive cases since reopening, we may have to consider closing down. Antigua and Barbuda, they have been threatened, I don't know if they followed through on it, with legal action by tourists who have tested positive and don't want to do the 14-day quarantine. Taking these lessons into consideration, let's talk about what Belize will do if we do face our worst case scenario, that we have too many positive cases come in that we can't handle.
Sure. Let me just say, for the comfort of those viewers out there, that we are working with our regional partners. We're sharing information on a regular basis. We understand the situation in the Bahamas. It's a little bit different from the approach taken by Jamaica. Yeah. And we realize that these decisions are still ours to make. Yeah. So that if we're following the data suggests that, look, we open on the 15th, but we have to have bans on certain travelers from certain countries. We can put that in place. We also have to look at what a threshold means to Jamaica versus what it means to Belize.
Yes.
Obviously, Jamaica has larger medical capacity
Yes.
than we do. They've had more cases, they have more testing kits, they have more hospital beds, for example. So we have to be very realistic. We're working with our partners at the Ministry of Health right now to look at thresholds. We're working in terms of looking at what the global spread is. I think it's no secret to everyone that the US market is growing at the fastest rate globally. And so we're bearing all of this in mind. An opening on the 15th could mean different things. And every day that we get more and more information, it changes or it adjusts slightly what we need to look at. The good news is that we're opening right now in what is traditionally the slow season, the slowest time of the year for arrivals. We're looking at the bookings right now and they're not tremendous. So one of the things that we are trying to do is to use this as a pilot test. And by doing so, we will see how many passengers we can accommodate, because you haven't asked a critical question yet for travel, but certainly clinics and testing at the airport means that the processing time for arrivals, etc., is going to be increased.
Yes.
So, there will be the norm that we are used to when it comes to travel and when it comes to moving around the country is going to be completely and perhaps permanently altered henceforth.
Has there been any consideration up to this point of following suit with some other Caribbean countries and not allowing U.S. travelers at this time? Perhaps looking at the Canada market or the European market?
Yes, most certainly. Unlike our Caribbean counterparts, however, we don't have direct flights. This is something that the DTB and the Ministry of Tourism have been angling for quite a while, which is to diversify our airlift into different markets. And, the difficulties there will be that if a decision is made to restrict the access or the travel of US citizens into Belize, the Europeans coming in, we do have direct flights to Canada, but primarily the European market coming into Belize will still have to be screened just as intently as we are planning to do right now. So all of the
have to travel
preparation
through the U.S.
They will have to travel through the U.S. And that's exactly why we will have to make sure that our safety protocols are at their best.
In respect of the hotels that are participating in this training program for gold certification, where are we with that? And perhaps what is the state of readiness for those respective resorts, hotels and resorts?
Sure, great question. Well, it's on it. The first phase of training has begun. Several hotels have gone through the process and completed it. If I could just explain how that system works a little bit. The ministry developed what are to be the national industry guidelines, which are a very generic protocol for operating your business with the biosafety protocols that have been recommended on a global basis. Then from there, each sector has developed, that we've been working on developing unique individual protocols for hotels, for restaurants, for tour operators, for transportation providers, for private yachts, for private planes, for rental vehicles. All of these things have a unique, specific set of protocols that are the training is being rolled out for. So when the quote unquote safe zone is complete and put together, all of those stakeholders within the zone have to have received the training and have to have the equipment and have to adhere to these protocols while operating within that area. So we're on the way. The target is to have the zones specifically ready by the 15th. I would say that we're about 40% along that line.
I'm a bit confused. You mentioned earlier about bookings. How are people booking hotels if there hasn't been any gold standard certificate issued as yet? Because you say you're 40% into the process.
Yes. What we have right now, like I said, is that we're actually testing our app. This is why the booking areas are, again, directly related to the use of the technology that we have now. So the app is being beta tested at this time. The hotels that are undergoing training are on the app. restricted access is being given for those who want the book, because it's not as before where you just, go online and pick up a ticket and I'm heading to Belize.
Yeah.
The new protocol suggests that you have to fill out forms. You have to, much like the repatriation forms, which are on the COVID-19 website. People need to go on, they need to put in their information, they need to put in their destination hotels. Personnel within the health and tourism sector now do the cross references and checks, and then you're green lighted to go ahead and do that. And then this is being done again because the risk is that you will have people who are second homeowners wanting to come back to Belize and they want to go to their homes naturally. You have Belizeans abroad who want to come back home right now. So all of the passengers are being basically filtered and approved based on where they're going to be in the country and their exposure to the population here. So those hotels are on the list. Those hotels are you can look at them and we update it as the hotels are passed. But remember that the focus here is to ensure that the safe zones are what are being maintained.
So they have been listed with the assumption that they will achieve the certification because you're working with them right now.
That is correct. That is correct. Unfortunately, if they don't, they'll probably have to hand over their guests to one of the hotels within the safe zone. But that simply is how we're going to have to roll this out. Yeah. We have to ensure that we take all the precautionary measures that we can at this time.
So the explanation given so far is that it's a phased approach, and this first phase includes hotels that offer. I've been saying all-inclusive. I know it's confusing, but it's full service. It offers everything that you need there. So I'd imagine your large-scale hotels are probably going to be in that first phase. Now, one of the main questions is, who does the policing? So when a tourist arrives on site after testing negative at the airport and has the tracking device and wants to leave, who handles the policing of their movements, what they can and can't do when they arrive on the property?
Excellent question, Marlene. This is why, like I said, the hotels are undergoing training, picking up or transforming staff to do these roles. Yeah. It's very similar to you going to any one of the stores now that has mandatory face masks and hand washing stations outside. There's always a guard there to ensure that you're following the biosafety protocols. The development of these training protocols within the safety zones, specifically per stakeholder, per subsector, means that you have to police it. And if you find, or if you do not do that, and you run the risk of losing that gold standard, you're not able to get that back. So again, the combined digital and human resource application that we're looking at right now means also that we will be checking up on you. We will be able to see that your QR code, we're not going to be using people's names or etc. But your QR code today booked at Hotel X, your QR code tomorrow booked a tour to go on a boat with this tour operator, and that tour operator was booked through the hotel, and they know that they're all operating within the safe bubble. This is not something we can take lightly. This is something that we all have to share and bear the responsibility for.
Now, and I'd imagine the responsible tourists who do come will follow through on all the protocols that are required, but much like our border jumpers right now, it's the ones who don't want to follow the rules that we have to be concerned about, and they're the ones who pose the greatest threat. So I think my question, to be more direct, is looking at people who want to try to get out of the hotel area, who want to go to an area that isn't approved. I saw on a recent post online talking about Belize's reopening, where people are talking about, hey, bring a burner phone and leave your tracking app at the hotel and use your burner phone when you're out. So it's not that people won't try to circumvent the system, it's what are we putting in place to mitigate those types of risks. So does the hotel then report if they see a guest leaving, if somebody goes out for a run in the morning or wants to go to a beach bar 2 hotels down? Who is then responsible for paying attention?
But let me just clarify before I answer that within the safe zones, the beach bar and the area, the beach access and other areas like that will already be cleared and okayed.
Okay.
So we're not trying to lock people in the confines
Into one
of-
property. Okay.
No. Second to that, though, like I said before, people who want any service outside of or want any service within the area need to present that up. The hotels and the guests will be asked to go through basically a lot of reading and to sign a waiver on that behavior.
Yeah.
If they are found to be in breach thereafter, we are working with the Attorney General's Ministry at this time now to look at stiff penalties for them, which may include the 14-day quarantine at their cost, which may include, having to penalize them and to lock them up. Yeah. But again, like I said, it's everybody's shared responsibility. So if the hotel finds that person XYZ tries to book a tour with a tour operator who doesn't have the necessary sanitizing equipment and hasn't been through the training, etc., both the tour operator and the tourists themselves will be made to pay for that.
So these
are the things. Sorry.
Go ahead.
I'm saying that these are the things that we're currently working on because much like yourselves, we're reading all of the comments that are coming in. And we understand that there is a split between those who want to see this soft reopening on the 15th and those who would prefer that we remain closed to the outside world.
Now, you've been around the country over the past few days. I'm pretty certain you've been interacting with stakeholders from north to south. Is there any particular sentiment coming from San Pedro and perhaps any specific concerns from hotel owners on the island?
Sentiment is abundant at this time, Isani. And like I said before, San Pedro specifically, there have been surveys going out. We've been receiving calls and chatting with some stakeholders, and it's a mixed bag. I'll be very honest with you. We're working right now. It's our responsibility to ensure that the right safety and biosafety measures are taken and that the proper protocols are in place. And that's what we're doing. There will be some resorts and some industry that will open up quite willingly to the market. I've also seen that some are saying, look, we're not going to open up to the international market this year, and that's that. And we completely respect those decisions. Like I said, our role at the Ministry of Tourism and along with the BTP is to ensure that this is done in the safest manner possible. And that's what we're continuing to do.
So I wanna talk about again some of the situations that may happen, and one of them we know is that there will be tourists that come to the country that test positive. I mentioned to you earlier the situation of people not wanting to go into quarantine in other Caribbean countries. So let's talk about what protocol exists if someone tests positive at the airport, and also if they start to show symptoms later on when already at their resort.
Certainly. At the airport, with the new facility being built, somebody testing positive from there will go into immediate isolation and quarantine.
Yeah.
There is a quarantine holding area being developed, and those people will be transported from there to a quarantine facility, and they will be kept and tested for the 14 days until they can show that double negative. Yeah. And then they have the option of returning home, or they have the option of staying in Belize for a bit longer. So they'll be treated very similar to the Belizeans returning home who test positive. Mm-hmm. If you are now in the hotel and you start showing symptoms and you come out and you're being asked to take the test and you're shown to be positive, this is where the app that we've been discussing kicks in, because that app will show me in your entire trace history. Mm-hmm. And so the representatives from the Ministry of Health then will come and do that entire basically that trace study to see where you've been, who you've been in contact with. All of those people will be tested. We will have basically a full map of who you've been in contact with while you've been in the country.
But what happens with the property? Is the property closed down? I mean, a guest in one property will eat at the restaurant, swim in the pool, come in contact with other guests there too.
But this is precisely why, for example, we have insisted in the training protocols. You maintain the basic things that we have been saying from day one.
Yeah.
Face masks, maintain your social distance, and make sure that your hand washing or the utilization of gloves, etc., for staff exists. Certainly now, if there is somebody who is socializing with groups who did not come into the country or are not members of their own family, the Ministry of Health then kicks in, and their protocols then suggest that they do sample testing for all people who have stayed there. Again, to further the questions on the protocols for the Ministry of Health, I'd recommend that you speak to them.
Yeah.
But what we know, for example, is that the whole idea of being able to do this tracing is so that we can ensure that this testing is done to all those who have been in contact with that one positive case.
And so anyone who enters the country will have to have signed something to say that they're going to submit themselves to mandatory quarantine for 14 days.
That is a part of the legal waiver
Yeah.
that exists with the app. And like I said, the beauty about it, Marlene, is that whereas it's mandatory for you to fill out what is called an E&D form, which is the entry and departure form for immigration and customs. Well, now that it's going to be digitally tied to the health app, you have to go through all of that and you have to sign that waiver. And, for everybody who remembers now what it was like to travel, that waiver is legally binding. If you break any of the laws on that, you can be fined or you can be arrested. And so we are applying the same thing to the actual health component of this application.
So let me get a better understanding of how much movement tourists who arrive in the country will be allowed to have. The first impression we'd gotten was that they'd only stay on the property itself and go on approved tours from that property. But I keep on hearing you referencing safe zones. What's changed?
It hasn't really changed. The properties that are being certified right now, we can use the term all-inclusive because they provide restaurant services, et cetera, et cetera. There are a few of them who do not have the full gambit of services, and they're allowed to sort of outsource those services to other properties that have been able to get that. So let's say, for example, that you and I have neighboring hotels, and I don't have a swimming pool. You're allowing the guests to go into the safe zone to use the pool, or you're allowing them to go and dine at your restaurant next door, or you're allowing them, as you said, to go to the bar. Those are certain areas that we're looking at right now, where, like I said, once you're in the zone and all of your personnel operations have been certified and you've trained, those allowances can be made.
And what about, if I go to Key-Cocker and I want to go hang out at the Split? I mean, it's the main attraction of being in Key-Cocker. If I want to go out for a run or ride bikes in Placentia or Hopkins, are these types of activities going to be allowed?
There are protocols being developed for the activities. Let me start with Key-Cocker and going to the Split. I don't think that we can certify the Split as a safe zone. But certainly different activities within different areas can be done. And like I said, the whole idea behind this is protecting our population. So, you're not at this stage, you're not able to encourage people to run about and go and look for, tour guides or people to talk with along the beach at this stage. But certainly ensuring that within the zones, and these are just idealistic zones, but within the areas that have trained personnel that are going to receive the gold seal, you're able to move around in there.
Yeah. And so when I arrive in country and I perhaps go through the rapid testing protocol, one of the things that we have not discussed is whether or not somebody's only coming for a shorter stay. If in fact they're doing a 5-day vacation and will not be, what do you do if somebody's supposed to leave within the time where they're under quarantine?
I'm sorry, the law of the land prevails.
Okay.
We've had this discussion both here with our legal advisors. We've had the discussion with people at health. We've had this discussion with the members of the Caribbean Tourism Organization. you come into the country, if you cannot bring your negative test and you're not 100% sure that you're negative, when you get here, there is no way that we can allow you to break quarantine until you have tested negative. Second to that, once you have been tested and you test positive, the airlines won't take you home until you're negative. So you are basically stuck and you have to follow what our laws stipulate. And our laws right now are stating that anybody testing positive for COVID-19 undergoes immediate quarantine. And that process is one of the principles behind this whole reopening exercise.
Okay. Yeah. And who covers the cost? I know the tourists are required to pay for the rapid test. What about quarantining tests and whatever else comes up after that?
The cost will be borne by the traveler, similar to that of the Belizeans returning home at this time. You know, there are special facilities that have special rates in place. And unfortunately, you know, you come in and you test positive, you're going to have to cover the cost of your quarantine.
Okay. Now, let's talk about what's happening in the United States specifically. They can't even agree on wearing face masks. I'm sure you and your team and the other stakeholders have discussed that there may be resistances to some of the protocols that we have been adopting for safety. How clear is the communication to potential travelers that they are going to be bound to what we decide is going to be best for us?
Well, Marlene, that's a great question. Let me put it to you like this. Those passengers can't get on the plane without their face mask. So the minute that you have stepped on board the plane, the minute that you have okayed the app and gone through what is there, the minute that you land at PGIA, you basically will be isolated if you don't have on the face mask or the equipment. People are using face guards now to be able to come into the country. Sorry, go ahead.
It goes back to the idea of being subject to the laws of the land, whereas in Belize right now, if wearing face masks is mandatory, then it also applies to visitors who are entering the country. They just have to comply with what the existing regulations are, correct?
That is right. I'll give you the best analogy I can find, Isani. This is like you having somebody come to visit you at your house.
Yeah.
And then all of a sudden, you know, they start to take off the shirt and the pants and everything else and throw it in a corner and want to walk around in there on the clothes. You're not going to allow that to happen. And so just like that analogy, we're not going to allow people to come here and to disregard the law, especially when public safety is at risk.
When you look at what Marlene had explained earlier, in the United States there are heated conversations over the wearing or the use of face masks. And so some people may come from specific states where they may not be allowed to have to wear face masks there, but once you come here, our rules and regulations are what apply. It doesn't matter what the philosophy is from Minnesota or Los Angeles, it's what applies to Belize.
Yeah.
That is correct, and I'm certain that if they don't want to voluntarily wear a face mask, that the Commissioner of Police has a face mask for them in the lockup.
Yeah.
Yes, but as the CEO of tourism, you know one thing, the impression that tourists have when they arrive in country is a part of the sales and marketing of the entire country. And time and time again, you know, I know hotels and restaurants that religiously follow reviews and posts that are made about them. So you also have to kind of manage just the overall experience that people have, even during traveling during a pandemic. So how do you, I'm sure that's a concern coming from hoteliers. How do I tell my guests, put on your mask and then start an agitated situation then on the property, at the risk of getting some horrible reviews or bad exposure?
That's a great question, Marlene, and I'll be honest with you. Since the onset of COVID-19, most of the marketing and most of what people are seeking for are safe destinations. That's more valuable right now than the cost index. That's more valuable than how very tropical your paradise is to offer, et cetera, et cetera, et cetera. People want safety. that has shifted where if you look at what's happening now with marketing in general, even commercial products are being rebranded to show that they are somewhat safe.
Yeah.
This is the way that the world is shifting. Now, all of a sudden, we went from a fun-loving population running around the globe where we were suffering from over-tourism.
Yeah.
Now we're all concerned about our health and well-being. People are exercising, people are eating healthy, and people want to go to safe destinations.
Yeah.
And we have to, we have to maintain that niche. We have to maintain public safety. Yeah. And we have to use that for our marketing advantage. And people coming in, if you look at some of the reviews for countries that have opened already, Jamaica in particular, they're wonderful reviews. People are actually stating that they feel safer in Jamaica than they feel back in the United States. Yeah. Yeah. If you look at what Barbados is doing, Barbados is saying, look, we are a safe destination. Come and work here for a year. We'll give you the permits. We'll allow you to move your family.
I'm glad you mentioned that. That was my next question. Have we explored looking at the Barbados model? Have we, I mean, it's perhaps, if you look at it, what they're saying is come long term. So if you have to do a 14-day quarantine, that's nothing if you're coming for 3, 6 months, a year. Have we explored going that route so that we can get travelers we know that are committed to staying and following through protocol rather than someone who just wants to come for a 4 or 5 day trip?
We have explored it. We actually are launching that after the 15th of August. Mm-hmm. But again, the critical mass for us is being able to get them here. So if we're able to successfully open the airport and successfully keep the COVID-19 numbers down, that launch comes thereafter. The difference between us and Barbados is that their airport is already open. Yeah. So they're moving back and forth. And they've gone for the markets, I think that Isani mentioned earlier. They've gone for Canada. They've gone for Europe. And these are the benefits of having direct airlift. We're working right now on all of those things. We're working right now on finding different air routes. We're working on allowing people to come in and work via those that can work from home or work via satellite to come in and work here and making those arrangements. So we're in discussions with people at immigration. We're in discussions with people in aviation and everybody else so that can be done as well.
You know, economically, it's a really tough time for the country. But I'm sure you know that many of the detractors of this decision look at this and say it is an even higher cost, the risk that we're putting our country under. As the CEO in the Ministry of Tourism, what do you say to people who are so concerned about and we're not just talking people who are worried about their own personal risks. You're talking about the risk of healthcare workers, of overwhelming a system that is already very limited in its capacity. What do you say to them?
My advice to everyone on this matter is that it's really that whether we like it or not, we are getting more cases. Mm-hmm. Border jumpers, even one mystery case the other day that we haven't really tied to community spread. But more and more cases are coming in. We cannot remain closed indefinitely because, like I said, the pressure will keep building up. So we have to ensure, and this is the position that the Ministry of Tourism works with, is that we have to ensure that we have the right protocol in place to protect the population and to promote the industry. And that's what we're trying to do as best as possible. Opening the airport on the 15th does not mean that we're going to have people just pushing down our gates to get in. But we have to get the practices right. We have to know what the protocols are. Yeah. And that's what we're pushing right now. The folks who are concerned and the folks who are not doing the training, we're encouraging you, even if you're not going to open in August for international tourists, go through and do the training. Look at the examples that are working very well. Mm-hmm. I think one of the unfortunate realities is that we are bombarded with television coming in from the United States. And when we start looking at those record numbers, every day they break a record in terms of community spread and deaths due to COVID-19. But there are small countries out there, much like Belize, that are doing a good job And those countries don't get the same exposure and airtime that we're seeing on basically the branded networks. But they're doing good jobs at controlling this, and we have to look at it that way. And should a decision be made, as we have discussed, that you're open on the 15th, but you're not going to be open to the U.S. market, or you're pushing back, Panama pushed back for another 30 days last week, in order to give themselves enough time to get ready.
If the situation worsens in the U.S., will we consider pushing back the date? Have you discussed that?
That decision is on the table. Also, is the decision to essentially to not open to the U.S. market.
Okay.
And these are the things that, again, are going to go to the National Oversight Committee, and they're being advised appropriately
Yashin,
of these dangers.
CEO, I'm sorry to cut you off. It's just that we're running out of time, and we promised our viewers online that we'd get in some of their questions. So Maxika was asking about when the Kate Jenny wants to know when the app will become available.
The app is being beta tested right now. My guys doing the programming, and it's not really my guys, but the volunteers that are working with us have promised that it will be up and running by the end of this month.
Okay. And Maxika wants to know if the waivers are legally binding.
Yes, the waivers are legally binding.
Kim Menhivar, based on what is being done, can Belizean Americans not come home and stay with or visit family and friends?
No, they will go into quarantine. They have to go into quarantine, especially if they're going to go into the general population.
Okay, and then Christine Young wants to know if beach bars and restaurants can also get gold standard rating so that tourists can use them as long as they comply.
Yes, there is a training protocol for restaurants that includes bars as well. So they can, they just need to contact the Belize Tourism Board and to arrange that once the training sessions are ready.
All right. Well, we did get in some of their questions there. We did make that promise to them. You know, there's still a lot to discuss, but we do appreciate that you've kind of broken down just some of the possibilities that may happen and the protocols that we're planning in the event that we do see these positive cases. Thank you so much for having this conversation with us.
You're most welcome. Have a good morning and stay safe.
All right, and best of luck to you. Stay safe as well. With that, we're going to go ahead and take a break. When we come back, there have been budget cuts at the National Health Insurance, and that means it has an impact on what you can be able to access at your clinics. We're going to get the details about it after the break, so please stay tuned.
This COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.